Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of obstetrics is antenatal obstetrics complications. We divided our lecture into 5 sections. In the first section, we will talk about musculoskeletal problems that develop during the antenatal period. And these include very commonly backache, then symphysis pubis dysfunction, and carpal tunnel syndrome. In the second section, we will talk about some gastrointestinal disorders and disorders related to gastrointestinal system. Constipation, hyperemesis gravidarum, gastroesophageal reflux and hemorrhoids, and also we will talk about varicose veins and oedema. In the third section, we will talk about abnormalities of pelvic organs. In this section, we will talk about fibroids and retroversion of uterus, congenital uterine abnormalities, ovarian cyst, and cervical cancer. In the fourth section, we will talk about venous thromboembolism, thrombophilia and deep vein thrombosis, pulmonary embolus, treatment and prevention of thromboembolism and pulmonary embolus. And then in the fifth and final section, we will talk about some other common complications which occur in the antenatal period. These include urinary tract infection, pyelonephritis, and some abdominal complications. So all these are very common complications or problems that can occur during antenatal time period, and we will talk about them in detail in this lecture today. So to learn more about this topic, keep watching sqadia.com.